So hi my friends, my name is Dr. Sayyedavna Mahmood. So today we are discuss about the bicornuate uterus or uterus malformations or anomalies. So you can see first the definition of the bicornuate uterus. So bicornuate uterus is uterine malformation that is produced due to the impaired in the fusion of melanin duct. The bicornuate uterus is a rare anomaly like the uterine morphology, but it is associated with worse reproductive outcome like recurrent pregnancy loss and the preterm labor are mostly common. The clinical and ultrasound finding is very important to consider for this bicornuate uterus because this is the misnomer's that the bicornuate uterus does not have any like conceive problems. No, we can conceive but have some problems. The female have a normal or heavy periods, no abnormal hormonal profile, painful menstruation sometime, irregular bleeding. This is the bicornuate uterus definition is a hum or markedly septation in the fundal position of the uterus with two endometrial cavities. So that the presenting as like an ultrasound as a heart shape, as you see in this picture, is a heart shaped uterus. You see here the hum in the two, and there is a two cavities of the endometrium. So and we have to do the 2D scan plan, and then 3D is much be helpful to see the cavities of endometrium. The clinical presentation of bicornuate uterus with on the horn pregnancy. The patient is with bicornuate uterus, had a recurrent vaginal bleeding during the pregnancy, and maybe some time is formed the subchorionic hematoma on the edge of placenta. And due to the bleeding, the presence of subchorionic hematoma is present around the 16 weeks. So we have to follow up around every 2 to 3 weeks if the bicornuate uterus have the pregnancy. Then this melanin malformation is also called as a separated uterus. So we have still have some time complaint of the off and on bleeding. So we have to check the cervix is long and close, and placenta is where it is posterior and interior. It is main important thing, and there is a minimal collection from the placental side or not. Sometime it will be happen with bicornuate uterus. Now we again come of the to see the normal uterus to abnormal malformation of the uterus. So you see the normal uterus have the cavity, and this is the myometrial thickness, and this is the internal os. But here you have to see the hum. So you can see the both cavity in the ultrasound, and then you have to see in the this is the two cavity in the picture. Sometime we have the very like the melanin formation is have only the one horn. How can we have to know? Because it is at the myometrial thinning, and then we have to measure myometrial thinning, so we know there is a unicornuate uterus. Sometimes is very small hum which called as a subseparated uterus, and sometimes is we have the separated two uterus which called as the diaphysis, and sometimes we have the separated at starting from the on the endometrial cavities, which are very important. Now 3D pictures are very important for take the myometrial thickness, and you know about the hum is actual hum or there is a technical problem. So you see here you have to measure the normal uterus. We have to measure the between the gap of the endometrial cavity. This is normal endometrial cavity. This is the myometrial thickness, and the fundus we have to measure the thickness, and it is not less than 5 millimeters, so it is not a hum. But you have to see here this is a properly increase of the septation. So we have to measure more than 5 millimeter to 10 millimeter, so it is presenting like the hum in the cavity. And this is the two cavities, this is the hum in cavity, and this is also sometimes the unicornuate uterus, which is have the small presence of myometrial thickness. So you have to see the myometrial thickness, hymen cavity, and there is a separation in the endometrium, and the internal os and vagina and cervix. So thank you so much. Hopefully you understand today the uterine malformation.